Hello friends, welcome back to my channel. Today in this video I'll talk about another very important infection, that is leptospirosis. Leptospirosis is a zoonotic disease caused by the spirochetal bacteria Leptospira. It can affect both humans and animals and has varying clinical presentations ranging from asymptomatic cases to fatal multisystem organ failure. It has a global distribution with rising prevalence rates. The worldwide incidence of leptospirosis is approximately 1.03 million cases annually, with 58,900 deaths. In tropical areas, the incidence of leptospirosis is up to 10 times higher. Factors such as higher temperatures, humidity, rainfall, and poor sanitation contribute to the increased risk. The proximity of humans to both rodents and domestic animals also increases exposure. Certain occupations carry a higher risk of exposure to leptospirosis. These include farmers, ranchers, veterinary workers, rice farmers, and military personnel who often come into contact with animals or water sources contaminated with leptospira. In developed countries, travel to tropical regions and recreational water activities have been increasingly recognized as source of infection. Leptospirosis is caused by the bacterium Leptospira, a spirochete. There are 21 species of Leptospira with 9 pathogenic species. These bacteria are classified into over 26 serogroups and 250 serovars, causing a variety of clinical manifestations. Leptospira bacteria are thin, corkscrew-shaped organisms with a characteristic hook at the end. They are motile and aerobic, growing best in temperatures ranging from 28 degrees centigrade to 30 degrees centigrade, which allows them to survive in water and soil for months. Animals, particularly rodents, are the natural reservoirs for Leptospira. The bacteria live in the renal tubules of many mammals, shedding through urine, which contributes to the persistence of the bacteria in the environment. Humans typically become infected by coming into contact with water or soil contaminated with Leptospira from animal urine. The bacteria can enter the human body through cuts, abrasions, or mucous membranes like the mouth, eyes, or nose. Though rare, leptospirosis can also be transmitted via accidental ingestion of contaminated water, fecal-oral route, or inhalation of aerosolized particles. In some cases, direct contact with the blood or urine of infected animals may also result in infection. After entry into the body, Leptospira spreads to the bloodstream and disseminates through the body. Its ability to cross tissue barriers allows it to infect almost every organ system, often before the body's immune system clears the bacteria. The clinical symptoms of leptospirosis vary widely. Many cases are asymptomatic, while others present with non-specific symptoms including fever, muscle pain, and headache. Severe cases can progress to multi-organ failure and death. The typical incubation period for leptospirosis ranges from 7 to 12 days, though it can be as short as 2 days or as long as 30 days after exposure. Most symptomatic cases of leptospirosis follow a biphasic pattern: an initial septicemic or febrile phase, which lasts for 5 to 7 days, followed by an immune phase where symptoms may improve as the body mounts an immune response. Symptoms at the onset of leptospirosis include fever, chills, headache, and muscle pain, particularly in the calves and lower back. Conjunctival suffusion, that is redness of the eyes without discharge, is also a common early sign, though it is not always present. Aseptic meningitis occurs in about 80% of leptospirosis cases, typically appearing around day 7 of the illness as the immune phase begins. This is characterized by inflammation of the meninges without the presence of bacteria in the CSF. In a minority of cases, leptospirosis progresses to severe illness such as Weil's disease, which involves jaundice, renal failure, and hemorrhage. Severe pulmonary hemorrhage and liver failure can also occur, with mortality rates ranging from 5 to 40%. Leptospirosis can cause dysfunction in multiple organs. Kidney failure is common, with 16 to 40% of cases developing renal issues. Hepatic dysfunction, coagulopathy, and pulmonary complications like acute respiratory distress syndrome are also observed. Leptospirosis commonly affects the kidneys, leading to renal failure. This is typically non-oliguric and often accompanied by hypokalemia. Renal function usually recovers with appropriate treatment, although it is associated with higher mortality. Liver involvement in leptospirosis typically presents as cholestatic jaundice with elevated levels of conjugated bilirubin. Although liver failure is rare, it can occur, but it is usually reversible and not a direct cause of death. Severe pulmonary involvement, including alveolar hemorrhage and pulmonary edema, can lead to acute respiratory distress syndrome. Pulmonary complications are associated with significantly higher mortality rates, with case fatality rate reaching 50 to 70%. Cardiac complications such as myocarditis, pericarditis, heart block, and arrhythmias may occur in leptospirosis. Non-specific changes in the ECG are common, but repolarization abnormalities are a poor prognostic sign. Laboratory findings in leptospirosis include mild leukocytosis with left shift, thrombocytopenia, and elevated inflammatory markers such as ESR and CRP. Renal involvement may result in elevated serum creatinine, and liver involvement can cause conjugated hyperbilirubinemia. Traditional microbiological methods such as dark field microscopy and bacterial culture can be used to identify Leptospira. However, these methods have limitations, including poor sensitivity and the requirement for specialized laboratory equipment. Serological methods such as microscopic agglutination test are the gold standard for diagnosing leptospirosis. MAT detects antibodies against different serogroups of Leptospira. However, cross-reactivity and delayed immune response can reduce its early sensitivity. PCR techniques, including both conventional and real-time PCR, are highly sensitive for early diagnosis of leptospirosis, even before the host's immune response develops. The modified Fain's criteria is a widely used scoring system that combines clinical, epidemiological, and lab findings to improve diagnostic accuracy. It consists of three main components: clinical features such as fever, headache, muscle pain, conjunctival suffusion, and organ involvement; epidemiological factors like exposure to contaminated water or animals; and lab tests including ELISA, PCR, and microscopic methods. Now let's look at how the modified Fain's criteria works. Each clinical feature, epidemiological risk factor, and lab test carries a specific score. Common symptoms like fever and muscle pain contribute a few points, while more severe conditions like conjunctival suffusion, meningism, and myalgias add higher scores. Exposure to contaminated water or animals also increases the likelihood. Lab tests such as IgM ELISA or PCR contribute the most to confirming the diagnosis. A total score below 20 suggests leptospirosis is unlikely, while a score above 25 indicates a high probability of infection. This systematic approach helps doctors make timely and informed treatment decisions. Early treatment with antibiotics is crucial for reducing the severity of leptospirosis and preventing complications. For mild cases of leptospirosis, oral antibiotics such as doxycycline 100 mg BD for 7 to 10 days, azithromycin 500 mg OD, or amoxicillin 500 mg TDS are the first-line treatments. In severe cases, such as those with organ failure or hemorrhagic manifestations, intravenous antibiotics like penicillin G 1.5 million units intravenous every 4 hourly or ceftriaxone 2 grams daily are used. Supportive care is essential for patients with severe leptospirosis. This includes monitoring and management of organ failure, especially renal and hepatic dysfunction, as well as managing electrolyte imbalances and maintaining adequate hydration. Dialysis may be required in cases of acute kidney failure. Corticosteroids are sometimes used in the management of severe leptospirosis, particularly for patients with pulmonary hemorrhage or inflammation. Preventing leptospirosis involves reducing exposure to contaminated water, wearing protective clothing, including rubber boots and gloves when handling animals or working in potentially contaminated environments can reduce the risk of infection. In higher risk areas or for individuals with high risk occupation, for example, farmers or veterinary workers, chemoprophylaxis with doxycycline 200 mg once weekly is recommended. Currently, there is no universally available vaccine for humans against leptospirosis. However, vaccines for certain serovars are available for animals, particularly for pets and livestock in endemic areas. In addition to regular chemoprophylaxis, post-exposure prophylaxis with doxycycline may be indicated for individuals who have had significant exposure to contaminated environments or animals. Environmental control measures play a key role in preventing leptospirosis outbreaks. These include ensuring safe water supplies, treating contaminated water sources, and improving waste management practices to reduce the risk of water and soil contamination by leptospira. To conclude, leptospirosis is a serious zoonotic disease requiring early diagnosis and prompt treatment to prevent complications. Thank you for watching. Hope you liked it. Like, subscribe, share, and comment. Do not forget to press the bell icon to receive notification of all such new videos.